If you are over 60, there is a good chance the blood pressure target you have been chasing for years is not actually the right one for you anymore, and almost nobody has taken the time to explain why. You sit down at the pharmacy machine, or your arm goes into the cuff at the doctor's office, and you glance at that number the same way you have for decades, hoping to see the same digits you have always aimed for. But here is the part that surprises most people. The target itself quietly shifts as you age, and if your doctor has not walked you through the reasoning, you could be misreading what your own numbers are actually telling you. By the end of this video, you are going to understand exactly why that happens, what it means for your heart, your brain, and your independence, and how to have a much smarter conversation the next time you sit down with your own doctor. Stay with me, because this is one of those topics that, once explained clearly, changes the way you look at every single blood pressure reading you take from now on. I'm Dr. Robert Vance, and I want to start by saying something simple. This is not about scaring you, and it is not about telling you to ignore your numbers. It is about giving you the kind of explanation I wish more people received in a rushed 15-minute appointment. Over the years, I have sat with so many patients in their 60s, 70s, and 80s who were carrying quiet confusion about their blood pressure. Some had been given one target in their 40s and never had it revisited. Some had been told different numbers by different doctors and assumed someone had made a mistake. Almost nobody had been sat down and told, in plain language, why the target itself changes as the body changes. Here is why this matters so much. Blood pressure is not just a number that either passes or fails like a test. It is a living signal, one that reflects how well your heart is pumping, how flexible your blood vessels are, how your kidneys are filtering, and even how your brain is receiving blood flow moment to moment. After 60, that signal starts to behave differently than it did when you were 35, 40, or even 50. And if the target you are using has not been updated to reflect that, you may be misunderstanding what your body is actually telling you. Let me explain how the old thinking developed in the first place, because understanding the history actually makes the newer guidance much easier to accept. For a long time, blood pressure guidance was built around a fairly simple idea. Pick one number. Everyone, no matter their age, tries to get below that number. High blood pressure, or hypertension, was correctly identified decades ago as one of the biggest drivers of heart attack, stroke, and kidney disease, so the early logic made sense on paper. Lower blood pressure generally meant lower long-term risk, so why not apply the same target to everyone? What this means for you is that this approach was never wrong exactly, but it was incomplete. As researchers followed larger groups of older adults for many years, tracking not just their blood pressure numbers, but their actual outcomes, something important came into focus. The same aggressive target that clearly protected a 40-year-old from future heart problems did not always produce the same clean benefit in a 75-year-old. And in some cases, pushing that older person's blood pressure down that far introduced new risks that were just as serious as the ones being prevented. This is where things become genuinely interesting, because it forced a shift in the entire question medicine was asking. Instead of asking, how low can we get this person's blood pressure? The question became, what is the safest, most protective blood pressure for this specific person, given everything else going on in their body? That shift from a single universal number to a personalized target is really the heart of everything we are talking about today. Let me walk you through the biology, because once you understand what is physically happening inside your blood vessels as you age, the reasoning behind your new target will make complete sense. Picture your arteries not as rigid pipes, but as flexible, living tubes that expand and contract with every single heartbeat. In a younger adult, those artery walls are elastic. When the heart pushes out a fresh wave of blood, the vessel wall stretches slightly to absorb that force, then relaxes back down before the next beat. That stretching and relaxing acts almost like a shock absorber in a car, smoothing out each pulse of pressure so it does not slam through the system too sharply. As we move through our 60s, 70s, and beyond, those same artery walls naturally become stiffer. This is not damage in the sense of an injury, and it is not something you caused through some mistake. It is simply the accumulated effect of decades of use, along with gradual changes like calcium deposits and cholesterol buildup within the vessel walls. When arteries lose that flexibility, the shock absorber effect weakens. The pressure from each heartbeat is no longer smoothed out as effectively, so the top number in your reading, called systolic pressure, tends to climb higher. Meanwhile, the bottom number, called diastolic pressure, often stays about the same or can even drift lower. The result is a wider gap between your top and bottom numbers, something doctors sometimes refer to as widened pulse pressure. Have you ever looked at your own readings and noticed that gap growing over the years, even while your bottom number barely moves? So many of my patients have brought this exact pattern into my office, worried that something had gone seriously wrong. In most cases, this is simply your arteries reflecting the natural stiffening process that comes with age, not a sign of sudden danger. But it does mean that using the exact same target you used at 40 may no longer capture the full picture of what is happening in your cardiovascular system. There is a second piece of this puzzle that is just as important, and it centers on something every person over 60 cares deeply about: staying steady on your feet and staying independent. As we age, the body becomes more sensitive to sudden drops in blood pressure, particularly when moving from sitting to standing. This is called orthostatic hypotension, and it is far more common after 60 than most people ever realize, often affecting a meaningful percentage of older adults at some point. If blood pressure is pushed too aggressively low through medication, especially without careful, gradual monitoring, an older adult can experience dizziness or a lightheaded, foggy sensation when standing up. For someone over 60, that is not a minor inconvenience. A single fall caused by that kind of dizziness can lead to a hip fracture, a hospital admission, a long recovery, and in some cases, a permanent loss of independence. This is precisely why doctors today weigh two very real risks against each other instead of chasing one number blindly. On one side sits the long-term danger of uncontrolled high blood pressure, damaging the heart, the brain, and the kidneys over years. On the other side sits the immediate danger of blood pressure pushed too low, increasing the risk of dizziness, falls, and reduced blood flow to vital organs in the here and now. Think about your own experience for a moment. Have you ever stood up quickly from a chair, from bed, or from the couch and felt that brief wave of lightheadedness pass over you? Many people wave this off as nothing more than standing up too fast. But when this happens often, it can actually be an important clue about how your blood pressure target should be set, and it is absolutely worth mentioning to your doctor rather than dismissing. Let me tell you about a patient I will call Margaret, who was 74 years old when she first came to see me for a routine follow-up. Margaret had been managing high blood pressure for more than 20 years, and her target number had barely been revisited since she was in her early 50s. She was proud of sticking to her medication schedule, and she told me, almost apologetically, that lately she had been feeling unusually tired, a little foggy in the mornings, and unsteady when she got up from her recliner. Her concern was simple. She thought something new and serious was developing, and she was afraid to bring it up because she worried it meant her heart was getting worse. When we looked closely at her full picture, including her fall risk, her kidney function, and how she was actually feeling day to day, it became clear that her blood pressure was being pushed down to a target that had been designed for a much younger version of herself, one without the same risk of dizziness or falls. The mistake was not medical negligence. It was simply that nobody had circled back to ask whether her original target still made sense for the person she was today. Working carefully with her doctor and never adjusting anything on her own, Margaret's target was gradually reconsidered to better reflect her current health. She told me a few months later that she felt more like herself again, with more steady energy throughout the day and far less of that foggy, unsteady feeling she had been quietly living with. Does any part of Margaret's story sound familiar to you or to someone you love? So many older adults are still living under a blood pressure target that was set years, sometimes decades ago, without ever being revisited in light of how their body has changed since then. This does not mean earlier doctors did anything wrong. Medical guidance evolves as researchers gather more information, and blood pressure recommendations for older adults specifically have shifted meaningfully over the past several years as this research has matured. But this next part is what surprises most people the most, and I think it is the single most important idea in this entire video. The shift in blood pressure targets after 60 is not about the medical community relaxing the rules or becoming less strict. It is about the rules becoming more precise. Major health organizations, after studying large groups of older adults over many years, updated their guidance to reflect something that simply was not accounted for in the older, universal approach. The healthiest blood pressure range for you personally depends on your overall cardiovascular risk, your kidney health, your history of dizziness or falls, and a broader picture of your physical resilience that doctors often refer to as frailty, which is really about your overall strength and stability, not just the number of birthdays you have had. This is exactly why your target might be different from your neighbors, your siblings, or your closest friends, even if you are all around the same age. It does not mean someone is receiving worse care. It often means your doctor is doing exactly the right thing by tailoring your number to your specific body and your specific risks, instead of applying a generic target that ignores your individual situation. Let me address a few common myths directly, because misunderstanding any of these can either create unnecessary fear or unnecessary complacency, and neither one serves you well. The first myth I hear constantly is the idea that a little high blood pressure after 60 is just a normal part of aging, so there's nothing to be done about it. This is not accurate, and I want to be very clear about that. Yes, blood pressure naturally tends to rise with age because of the artery stiffening we discussed earlier. But that does not mean elevated blood pressure should simply be shrugged off as inevitable. Uncontrolled high blood pressure still meaningfully raises the risk of stroke, heart attack, heart failure, and kidney disease at any age, including well into your 70s, 80s, and beyond. The goal is never to ignore high numbers. The goal is to find the right, individualized target for your specific body, together with your healthcare provider, rather than either accepting high readings passively or panicking over every fluctuation. The second myth is the opposite extreme, and it is just as common. Many people assume that when it comes to blood pressure, lower is always automatically better, no matter what. As we have discussed, pushing blood pressure too aggressively low in an older adult, especially through rapid medication changes made without careful supervision, can increase the risk of dizziness, falls, and reduced blood flow to organs like the brain and kidneys. Research suggests that for many older adults, particularly those who are more frail or who already have a history of falls, a carefully individualized target may actually offer more real-world protection and a better overall quality of life than chasing the lowest possible number on the screen. The third myth is the belief that once you start blood pressure medication, your dose and your target are meant to stay exactly the same for the rest of your life. In reality, blood pressure management is something that often needs to be revisited over time, sometimes every few years, sometimes sooner if your health changes. As you age further, as other health conditions develop or improve, and as your body composition and activity level shift, what worked well 5 or 10 years ago may no longer be the ideal approach today. Needing an adjustment is not a sign that something went wrong in the past. It is simply part of thoughtful, ongoing health care that keeps pace with the person you are now. I want to pause here and be very direct about something important, because this really matters. Nothing in this video is meant to encourage you to stop, skip, or independently adjust your blood pressure medication. Please do not change your dosage or discontinue anything without speaking directly to your healthcare provider first, since sudden changes can carry their own real risks. My goal today is to give you understanding, not instructions to act on alone. When you understand why your target may look different than it once did, you can walk into your next appointment asking sharper, more informed questions instead of simply nodding along at a number without context. So let me state the core insight as simply and clearly as I can, because I want this to be the one thing you remember, even if you forget everything else. Your blood pressure target after 60 is usually not about chasing one universal number anymore. It becomes about finding the specific number that protects your heart and your brain over the long term, while also protecting your daily steadiness, your energy, and your independence right now. It is a genuine balance between two very real risks, not a single, simple finish line. Now let's talk about the practical factors your own doctor may be weighing when they set your personal target, because understanding these can make your next conversation far more productive. One major factor is your overall cardiovascular risk profile. If you have a personal history of heart disease, a previous stroke, or other cardiovascular conditions, your doctor may recommend a more focused, tighter blood pressure target, because the protective benefit in your specific case may outweigh other considerations. A second factor is kidney health, since blood pressure and kidney function are closely intertwined, and certain targets are specifically adjusted to protect your kidneys over time. A third factor is your personal history of dizziness or falls, which we have already spent real time on because it matters so much for quality of life. And a fourth factor is that broader picture of frailty and resilience I mentioned earlier, which looks at your actual strength, mobility, and stability, not simply the number of years you have lived. Let me tell you about another patient, a man I will call Walter, who was 81 years old and still walked nearly 2 miles most mornings with his dog before breakfast. Walter's overall health picture, including his strength, his steady balance, and his complete lack of dizziness symptoms, meant that his doctor felt comfortable keeping him closer to a more standard, tighter blood pressure target, even though he was well into his 80s. Now compare that to Margaret's story from earlier in this video. Two people, similar in age, but with genuinely different bodies, different risks, and appropriately different targets based on their actual health rather than their birth year alone. That comparison is really the entire lesson of this video in miniature. Have you ever wondered why your doctor asks so many seemingly unrelated questions before landing on your blood pressure goal, about your balance, your energy levels, your other conditions, even your daily activity? It is not simply paperwork or box checking. It is because a responsible, personalized target has to reflect your whole health picture, not a single isolated number pulled from a chart. Now let's move into something practical, because understanding the why behind all of this is only truly useful if it leads somewhere you can actually act on. Here is what I would encourage you to do with everything we have covered today. First, if you have not had a direct conversation with your doctor recently about what your personal blood pressure target actually is and why that specific number was chosen for you, that conversation alone can be genuinely valuable. Consider asking something as simple as, given my current health and history, what blood pressure range are we aiming for? And how was that decided for me specifically? A question phrased that way invites your doctor to walk you through their actual reasoning, rather than simply repeating a number you already knew. Second, pay close attention to how you feel day to day, not only to what the monitor displays. If you notice dizziness, lightheadedness, unusual fatigue, or a sense of unsteadiness, especially right after standing up, this is worth mentioning clearly to your doctor. These physical symptoms can be every bit as important as the numeric reading itself when it comes to fine-tuning a target that is right for your body. Third, if you check your blood pressure at home, try to take your readings under consistent conditions. Sit quietly for a few minutes beforehand, keep your feet flat on the floor, and support your arm at roughly heart level. A single reading can be thrown off by so many small factors, from recent movement to stress to how you were seated. So tracking a pattern over days and weeks gives your doctor far more useful information than any one number taken in isolation. Fourth, remember that everyday lifestyle habits still matter tremendously, even as targets become more individualized with age. Staying physically active in ways that are appropriate and genuinely safe for your body, eating in a way that supports heart health, managing stress, prioritizing quality sleep, and being mindful of excess sodium can all support healthier blood pressure over time. These habits are absolutely worth discussing with your doctor as part of your complete plan, alongside whatever medications you may already be taking. Now, I finally understand why this happens is something I hear often from patients once we walk through this reasoning together step by step, and I hope you are feeling that same sense of clarity right now. The central insight I want you to carry forward is this. Your blood pressure target shifting after 60 is not a sign that anyone is relaxing the rules or being careless with your care. It reflects a more thoughtful, more precise understanding of what genuinely protects older adults, weighing the real, well-documented dangers of high blood pressure against the real, equally well-documented dangers of pushing your numbers too aggressively low. This information is educational and is not a substitute for personal medical advice from your own healthcare professional. Every person's situation is different, shaped by their unique history, their current health, and their individual risks, and only your own doctor, who knows your complete medical picture, can determine the healthy blood pressure range that is truly right for you. If there is one single thing I hope you carry away from our time together today, it is this. The next time you glance at your blood pressure reading, try not to measure it automatically against a number you memorized decades ago, or against whatever target a friend or family member happens to be using. Instead, remember that a proper blood pressure target should come from an ongoing conversation, one that genuinely considers your heart, your kidneys, your balance, your daily energy, and your personal goals for staying active and independent in the years ahead. I would really love to know your experience with this. Has your blood pressure target ever been explained to you in this kind of detail before? Or is this the first time you have heard the full reasoning behind why it changes with age? Share your thoughts, your questions, or even your own story in the comments below. So many of the topics I choose to cover in future videos come directly from the conversations and questions you bring to me here. So please do not hesitate to speak up. Take care of yourself. Stay genuinely curious about your own health rather than simply following instructions blindly. And never feel shy about asking your doctor to explain the why behind any number on your chart, blood pressure or otherwise. You deserve to truly understand your own body, not just manage it from the outside. In our next video together, I want to walk through another number many people over 60 misunderstand almost as often as blood pressure, one connected closely to cholesterol, and why the advice you may have grown up hearing about it might not tell the whole story either. Until then, take good care of that heart of yours. It has been working faithfully for you for a very long time, and it deserves to be truly understood, not just quietly managed from a distance.